Hello and welcome to Spiritually Humanly Healthy, a podcast encouraging persons of faith to begin and commit to a lifestyle that reflects the connection between spiritual health and physical health. Spiritually Humanly Healthy is a production of Mount Sinai Ministries in Cleveland, Ohio. I am Mark Ribbins. I'm your host. I'm pastor of Avon Avenue Baptist Church and a community outreach program manager for SCIT, which is Stopping Cancer in Its Tracks, a program at Cleveland Clinic's Taussig Cancer Institute. Joining me today are two of my colleagues in Taussig Community Outreach. Samantha Davis is Outreach Program Manager for Zone 6, which covers Mansfield and the Richland County area. Miriam Hernandez is Program Manager for Zone 3. She's based at Lutheran Hospital, and her communities include downtown Cleveland, Ohio City, and Slavic Village, among others. So Miriam, Sam, welcome. Glad to have you here.
Thanks for having us.
In the whole team and the spectrum of Taussig Cancer Outreach, I'm the newbie. So how long have both of you been with the Taussig team?
So I have been with the Taussig team for about a year and a half, but I've been with the Cleveland Clinic for going on 20 years now in a variety of different roles through a variety of different institutes. But I joined Taussig in April of 2021.
And I joined both Cleveland Clinic and our team in October of 2018, so almost 4 years.
Okay, so yeah, I feel very new, but we're a great team and a really cool family atmosphere as we work together. What drew you to this kind of work? I mean, we all come from different avenues, some of us completely outside of medicine like me, others of you closer in. What draws you so closely to the work that we do with community outreach?
I've always had a passion for community outreach. I've devoted a lot of my personal time volunteering for various organizations such as the American Cancer Society, Special Olympics, the American Lung Association, just doing various bits of volunteer work, whether it was through outreach, whether it was through fundraising. So I've always just kind of had a passion for it. And then when I saw this particular opportunity pop up, you know, we were about a year into COVID, and it was just time for a change. It was time to do something that you were passionate about. Like, I think COVID made us all realize that life was too short to not be doing something that you feel strongly about. So I applied for the position, and I've been tackling the Mansfield-Richland County area ever since.
Cool. How about you, Miriam?
So for me, I've always had, I feel, some type of role in healthcare, whether it be direct contact with patients or indirectly administratively. But one of the things that I have known for a very long time is that working with the community is what fills me. So I always looked for projects, even if I was just doing administrative work, I always looked for projects where I would be able to help the community in one way or another and have that communication with them and seeing the impact that you have when you help. So I knew that that was something that I wanted to do. And I actually joined a year or so before the pandemic. So I've been able to see a little bit of both sides of community outreach. Before, when we were out and about on a daily basis, evening, weekends, you name it, we were out there. And then with the shutdown and how we had to pivot and find ways that we could still do the work, the very important work that we needed to do without having the ability to be directly with the community. So I think it's been fulfilling for me for a very long time to know that the work that is provided to underserved individuals and communities in need is something that, you know, just warms my heart. And the fact that I get to do it as my job just makes it that much better for me.
Love it. I should mention at this point, and we'll mention again, that for people who want to see more about what we do and connect with what we do, you can go to ccf.org/cancer community outreach. That's our homepage for all of the work that we do, and you're able to keep up. You can even volunteer if you want to work alongside in some of the things that we're doing. So one of the major efforts, and it seems like we always have something major that's happening at Taussig Community Outreach, but we've got a big effort that's coming up in October. You two have combined to work on it in a lot of different ways, but let's talk about this huge thing that is called what?
So in October, we have our Health Within Reach event. This would be our second annual event. And initially, this program was tasked to us last year by our administrator, who wanted us to come up with a way to collaborate with other institutes within the Cleveland Clinic as well as other community partners to bring all of these resources and services together to meet the needs of our community. The initial plan for this was to reach some of our caregivers that are contracted employees, so not necessarily employees of the Cleveland Clinic. We contract a lot of different services through environmental services, through nutrition services, and we know just from talking to employees in our facilities that sometimes it's hard for them to take care of themselves because of the nature of their job. They don't have some of the flexibility because they're not employees of the Cleveland Clinic. Maybe their insurance is not as top-notch as what we are afforded. So we wanted to give them an avenue that they could take care of some of these preventative health screenings, blood pressure checks, mammography, lung cancer screenings, anything that they would qualify for, and realize what other services and resources were available to them in the community. So it started as that, and then once we started that, it kind of just snowballed into, well, why just stop at our caregivers? Let's extend this out to our communities, and let's bring in anyone who can benefit from some of these services. So last year we had to pivot a little bit. We weren't able to bring in as many of the outside vendors as we wanted to because of the COVID restrictions that we still had, but we were able to connect people with opportunities for screening. I think we screened over 100 people on that day.
Okay.
It took a mountain of volunteers and the efforts of all of our program management and patient navigation team, but we were able to screen over 100 patients. And it was just word of mouth, and it was flyer distribution, and it was utilizing our relationships with various community partners to get the word out and bring the idea to the communities. Our faith-based communities have been instrumental in getting what we're trying to do out into the hub of the heartbeat of the different communities. So it started as that. This year, we're doing it again, same kind of thing. COVID restrictions are a little bit less, so we're able to bring in some outside vendors and really just have different community partners that are going to be available to talk to all of these individuals that will come in to receive screenings. Our focus has always been kind of on our underinsured or underserved population, some of those that may fall through the cracks of some other things. We do what we can to try to make sure that they have the means to take care of themselves and really put their health first.
That's pretty cool. And the genesis of it is really interesting because what you said really resonated with me. A lot of people on the outside looking in would think, oh, you work for Cleveland Clinic, you've got great insurance, you've got great coverage, but there's so many moving parts that some people are not covered because they're contracted employees and so forth. So we give the opportunity for them to have the screenings that we provide, other screenings, but there are other types of things that go on there, right, Miriam?
There is. So as those of you who work in healthcare know, sometimes the caregivers are the worst patients. So we have found that within our own rounds in our hospitals and clinics, we find lots of caregivers that have not had their cancer screenings in years or have never had them. So, one of the main reasons that we often hear is, I don't have the time. I can't take time during the week. We all know what a great impact COVID has had in the shortage of our nursing staff. So that's one of the things that we wanted to make sure to try to reach out and get from our caregivers, give them the opportunity to come in and see us, hopefully on a day when their departments are allowing them to, take the day. So on Saturdays, there's services that you would usually not find. So something like a colonoscopy being offered on a Saturday is not as common as you would think. So being able to provide that type of service allows us to be able to bridge that gap for the community and our caregivers that may not have been able to have that done.
We're talking with Sam Davis and Miriam Hernandez. They are program managers in Taussig Community Outreach. We're talking about Health Within Reach, which is taking place at Taussig on Saturday, October 22nd. And beyond the screenings, there's going to be some different things that will take place. People will be able to talk to a chef about healthy eating, or maybe even some haircuts involved. So it's kind of a day long. It's almost got kind of a festival atmosphere.
Yeah, we're really hoping for it to be kind of not just a health resource fair, but kind of take care of any of the needs that someone may have. So, for example, if someone is lacking and does not have like a primary care doctor that they see, we'll have different organizations there, or some of our patient navigators that are there that can help connect them with what we like to call a medical home. And by having a medical home, what we hope then happens is that people will stay up on some of their routine screenings, and they won't be lagging behind because they'll have that relationship with their provider. You talked about healthy cooking demonstrations. We're planning on having the food bank there. We're planning on having, like you said, haircuts. A lot of people have come together and done some volunteering and donating of their time so that we can provide all of these services. We're also working on trying to get a dental van there so that if people need dental screenings, you can do dental screenings or dental cleanings. We really try to make it as well-rounded as possible, and we try to think, collaboratively as a team. We try to come up with every possible thing that someone may need, and we try to do it as like a one-stop shopping so that you can check off a lot of boxes and only have to utilize one day to do so.
Yeah, so on top of all that, we'll be providing all of the screenings that our community outreach team provides, which includes mammograms, HPV screenings, pap smears, HPV vaccinations, colonoscopies, lung cancer screenings. But on top of that, we also know, like Sam mentioned earlier, we know that our communities are in need for blood pressure checks. We know that they're in need for other services such as vision screenings, the dental piece of it. So that's where we come together and try to find ways that, even though that's not an area of our focus for our team, because we're part of the Cancer Center, we know that those are things that are very much in need in the community, and try to bring that in one location.
I was just on a Zoom this morning that was talking about breast health and inequities in breast cancer awareness, and the numbers of breast cancer that seem to be increasing. So with the event that's going on, Health Within Reach, with October being Breast Health Month, it'd be a good time for someone who's not had a mammography to come out and get registered and get in. How can our listeners who are a part of SCIT, our SCIT congregations, how can they get involved? Because, what started as in-reach has become outreach and more of a community event. How can we help them to get involved?
So the Health Within Reach, we actually ended up using a play in words for that. So initially the in-reach was for our caregivers, but then we wanted to make it within reach for everyone in the community. So anyone who would like to participate or who would like to receive services or even volunteer, they can contact us at 216-444-7505 and let us know that they're interested in participating in the event, whether it's receiving services or volunteering. The event is going to run from 9 a.m. to 4 p.m., and the location of the event is our Taussig Cancer Center at 10201 Carnegie Avenue. So anyone who's interested, we welcome them to give us a call. If it's for screening services, our patient navigators are going to then go and review with them what services we are providing that they may be eligible for. So you mentioned mammography. Mammography usually begins at the age of 40. That's when most women will start to see that on an annual basis, recommended by either their GYN or their primary care physician. So anyone over the age of 40 who is able to come in for a mammogram, who has not had one within the last year, we would be happy to schedule that for them.
A part of the SCIT program, a major part of the SCIT program, is reaching out to the surrounding community. And this is almost like that in reverse, because now we at Taussig reach out to the 1 mile radius around us and say, okay, X congregations that we have around us, we've got this event and you're welcome to be a part. And we have such a wonderful family of volunteers in the SCIT program, people who are survivors, cancer survivors, or just great advocates who are interested in being a part of the work. So if you're listening to this pod and you say, hey, I've got some time free on Saturday the 22nd. I'd like to come and help. By all means, do get in contact. You can contact the number that Miriam left for you a little while ago, or get in contact with me at 216-299-1645. Again, we are speaking with Sam and Miriam from TOSIG, my fellow program managers in the work in fighting cancer. How does this all get paid for? I mean, it sounds like on a grand scale a wonderful thing to do, but at the end of the day, these services have to get covered. How do we do that?
So the Cleveland Clinic is very, very involved in taking care of their communities. They're very invested in providing a community benefit to all the areas that they serve. So one of the ways they do that is through philanthropic dollars. The Cleveland Clinic has a lot of donors that donate to the Cleveland Clinic to help fund some of these programs. In addition to that, we work with the philanthropy team on various types of grants that we can write to cover some of these services. As a matter of fact, for this particular InReach event, as a subset of it, for the mammograms and the Pap and pelvic HPV screenings, we are utilizing the STT, the C-Test Treat grant that we received funding for, that will be covering the cost for anyone that is coming in to see the services that does not have insurance. We don't want lack of insurance or being underinsured to ever be a deterrent from someone taking care of themselves.
STT it's been interesting ever since you all first mentioned it to me. And for those who are listening, we have a myriad of initials that we deal with in our outreach work. And so every time I hear a new set of initials, what's that? What's that? C-Test Treat. What's the story on that?
So C-Test Treat is a grant that we were awarded last year for the very first time. And it's a grant that's awarded through the CAPS, so the College of American Pathologists. And this is a program that is done throughout the United States at different locations at different times. So the efforts are very specific towards the mammography portion of the event and the HPV pap smear portion, cervical cancer testing. So these two items are something that the College of American Pathologists obviously have a great investment in. What makes it unique is that this grant allows us to have a pathologist on site on the day of the services to provide the results of the pap smears to the women that are coming in and receiving services that day. So they actually get to talk to the people that are running the test that day. So that makes it different and unique from anything that we've been able to offer in the past. We have a variety of different departments, physicians that are willing to come and speak with our patients. They have volunteers through the CAPS organization that are also able to give testimony for some of the other locations and what they have been doing in the past. So we look forward to our first annual STT grant and look for this to become something that we do on an annual basis.
And this is not an automatic. This is something that a lot of writing and a lot of work and a lot of blood, sweat, and tears goes into applying and getting this grant, right?
Yes, it is something that we have to apply for every year. So Miriam and I, along with the team from philanthropy and the team from research, are currently working on the next iteration of the grant and applying for it for 2023 funding. Okay. So while we're simultaneously getting ready to implement the program that we were awarded funding for last year, we're also thinking ahead to what we possibly may need to change and hoping to get that funding again so that we can continue to offer these types of services to women.
Great. So as we record this, we're about 8 weeks away from the event, and we know that time's going to go really quickly. So let's recap, and definitely I want to have you back to talk about vendors and more people who are going to be involved. You come back and talk with me again?
Absolutely.
Yep.
So recapping again, Saturday, October 22nd, what time?
9 a.m. to 4 p.m.
9 a.m. to 4 p.m. It is Health Within Reach, and you're welcome to be there. How do people find out more?
So they can contact us by calling 216-444-7505. And they can also go to our website. I believe you provided that earlier. We will also have flyers that are going to be distributed in the community. They can reach out to any one of us to learn more. And again, that could be on the basis of coming in to see us as a patient, or coming in to help us as a volunteer. We have lots of different positions. You don't have to be medical to help us. As you can imagine, something this large requires a lot of hands and a lot of people to put it together. So,
Any last words, Sam?
No, I think we've covered, most of it. We're really looking forward to being able to do this again for our communities. And, the whole premise of this is to kind of our whole outreach. The reason that we do what we do is we want to decrease late-stage cancer diagnosis. So part of doing that is increasing awareness on the importance of cancer screenings. So not only are you going to be provided the opportunity to get screenings regardless of your ability to pay, but you're also going to get education. We're going to have, a lot of different education stations to talk to people and be able to answer questions about why it's so important to have these things. We really want people to have the opportunity to ask questions and to empower them to take charge of taking care of themselves and putting themselves in a position to watch their health.
Great. So beyond just a screening, it's an education, and that's what we're all about. Mm-hmm. Samantha, Miriam, thank you so much for sharing with us today. And we're looking forward to Health Within Reach in October and looking forward to speaking with you again. This has been Spiritually Humanly Healthy, encouraging you to begin and commit to a lifestyle that reflects the connection between your spiritual and your physical health. For more information on SCIT and stopping cancer in its tracks, or to reach me or to reach either of these ladies here, visit ccf.org/cancer community outreach. Spiritually Humanly Healthy is a production of Mount Sinai Ministries. Visit them online at Mt.Sinai-Ministries.org. I'm Mark Ribbins. Thanks for listening and watching.
Thanks, Mark.
Thank you, Mark.